In today's episode of 340 Banter, we're recording live from the 340B Grantees Conference in Houston, Texas. We're joined by Angela Sorber from Nevada Health Centers, who's going to be talking to us today about her health center and their pharmacy operations.
Welcome to 340 Banter, a podcast dedicated to exploring the journeys, challenges, and successes of our 340B community. Our goal is simple: to engage, inform, and empower you to make the most of your 340B program. In each episode, we discuss real-world experiences and opportunities across the worlds of pharmacy and 340B. You'll hear from industry leaders and experts as they share insights and explore the impact on covered entities, pharmacies, and the communities they serve. This podcast is produced by Grit and Gravel, your partners in marketing strategy and success. Now, let's get to the banter.
Thanks for joining us, Angie.
Yes, absolutely.
We wanted to talk about the unique nature of your pharmacies, since I know you're spread out a little bit across Nevada.
Having driven the distance ourselves.
Yes.
Oh, yes. So we have a in-house pharmacy in Carson City, Nevada, as well as our rural area in Elko, and in Las Vegas, our MLK clinic.
Vastly different
Oh, yeah.
areas.
And I think that there are some challenges from a business standpoint in trying to standardize your operations across your
Absolutely.
pharmacies while also trying to cater to, the unique areas and populations within those. So kind of what have you had to navigate as you've looked at your pharmacy business to make sure that you have standardized what you can standardize while also meeting the needs of those unique areas?
Mm-hmm.
Yes. Starting out in Carson City is the one we opened in 2012. Vastly different from anywhere else. So as we opened at MLK, it is
Which MLK is your
in
Vegas
our Las
site.
Vegas, Las Vegas site. They have clinics throughout Las Vegas that we're trying to reach, the patients we're trying to reach, and a huge unhoused population. So making it where we can get medications available to the patients and that kind of thing. So as we've, opened and maneuvered and changed lots of things. So it definitely is different from the other sites. And then you go out to Elko, where it's the rurals and, people don't live necessarily in town. How do you reach them? That kind of thing. So definitely changing our procedures as we go and making things best for the patient. So
If I recall, didn't you have to, for Elko, you have to mail a lot of prescriptions
Absolutely.
or deliver
Yeah.
in order to be able to really engage with a lot of your population out there? Yeah?
yes. They do courier service out to Wendover, Jackpot, Carlin, the surrounding areas. So big drives. Yeah.
And I think something that kind of strikes me is, and thinking of my pharmacist brain, is the payer mix is going to be so different between those sites. I'm sure you're dealing with a lot more cash paying patients when you're talking about your unhoused patients. So you got to deal with you have a lot more discounts. So the metrics look very different between them.
Absolutely. Each month we're looking at it and seeing what, doing a comparison of the three, and you see it. It's glaring. Absolutely. Yeah.
What have you encountered in terms of kind of strategies to unite or be able to kind of synergize? I hate using buzzwords, but I guess that one, I'm going to use it anyways. Synergize, leverage what works from one pharmacy and be able to build off of it at the other two pharmacies, even though it's not going to be a copy and paste situation because, like you've said, one is very rural and one is very urban. And you're dealing with vastly different populations, likely different disease states, so different drugs that you're keeping in stock, different payer mixes. But how do you take successes from one of those pharmacies and kind of build off of it at the others?
The engagement of our pharmacy teams is huge. Our pharmacy managers, they know their towns. They're very engaged. They work closely with the providers in the clinics. It's, we get an idea. Why not try it? Let's see if it works. If it doesn't work, right?
Yeah.
So that's kind of our thinking process is, and also reaching out to other FQHCs. There's ones that are,
That's great.
Even you with your Ohio and your rurals, and sometimes we got to pick your brain, So I think that's just the best strategy for us is definitely trial and error.
And that's at my FQHC, that's one of the things I always told people. It's like, I'm willing to try about anything. Bring me your ideas. We'll try something. We may not stick with it.
Yeah.
But,
Yeah. Then you know.
we got to try it. And sometimes failure teaches us something about the situation. But I love that you're able to individualize the care at each site while still being a cohesive team. So I guess to do that, what do you do to kind of get your pharmacies communicating? Are there anything that, any meetings or things you're having virtually where you can get some cohesiveness between the pharmacy teams?
We meet weekly with our pharmacy managers, and ideally to have all team meetings at least once a year with the whole team. Everybody we're just so open and available. So you almost feel like you're there, but
Even though you're
yeah,
a
even though
very
you're not.
long
Yes.
drive away.
Or a very short flight, depending on the
Yes.
situation.
Yes.
Yes, that's true. Yeah. No.
Really fun if you're driving across the Salt Flats, and unfortunately Logan has taken charge of the radio, and you're listening to some very calming church music.
Oh.
And you're tired, and there's nothing else to look at.
And Chelsea's too awkward to tell me to change it to something else.
It took me a while to garner the courage to ask. So I know that you guys also leverage some clinical pharmacy services across your sites, and that probably changes depending on the populations that you serve and the operations within your pharmacies. How does that change? Again, depending on the sites and the populations and the types of settings that you're sitting in, urban versus rural.
It's evaluating the need, again, with the clinic providers and what is their, what are they shooting for? What is, the pharmacy team going for? What is the organization looking at, tackling? So we've had, HIV, we've had Hep C, we've had different things like that. We've had co-visits that some of our providers love. So it's definitely something, it's baby steps, and it's something we're looking to grow. But
do you see those having a larger impact in your more rural area or your more urban area, or not really specific to one or the other?
we haven't really explored it in the rural area just yet. It's something we're watching and we keep asking about. But for sure, Las Vegas area, 100% the need is there. And same with our Carson City. The providers, they enjoy it. They love bouncing off ideas with the clinical pharmacists. They walk into our pharmacy, it's ask questions. It's a great
That's
team,
what I loved
teamwork.
about my health center. We weren't doing it really structured clinical pharmacy visits at that point when I left full-time there, but the teams just walk into the pharmacy.
Yeah.
And I love when the nurses and providers are coming in, they're asking questions. And I had one provider when I first started, I got her really on my side by catching a duplication of therapy that one of her patients had. So then she would bring every patient to my office because she walked them to check out, and she had to walk by my office, and she'd introduce every patient early on to us, which was great to grow the pharmacy.
Absolutely. Absolutely. I think sometimes you just don't know because we know it so well. So it's hard for us to really explain it to, but once they see it, right? That engagement, the patient, they're hooked. Even the consultation that they have when they pick up their medications, it's like, I don't get this at other places. So I'm definitely, I'm coming back.
Yeah.
Yeah, and that's great, especially when you're dealing with a population that has a lot of barriers to care, like the unhoused, that they can get a higher level of pharmacy care.
Yes, absolutely. Our unhoused clinic in Las Vegas has a clinical pharmacist there working as the dispensing technician. So it's a little unique, but he assists the providers. He is, and also is just passionate about that community. And so when they courier over the drugs, he does all the counseling. I mean, it works.
That's an incredible way to be able to reach that population
Yeah.
and ensure that they maintain access to care.
Yeah, it's great. It's working good.
It sounds like you're doing a lot of great things and working through the challenges of being so spread out
Yes,
and trying to keep a cohesive team. So I think they're great ideas for people, especially when you're in a big FQHC and cover a vast area. It creates challenges, but there are ways around it. And I think technology and virtual meetings have made that so much easier to connect.
100%. Oh, yeah.
Well, thanks for sharing with us today.
Yeah,
Yes,
thank
thanks
you.
for having me.
Thank you for listening to 340 Banter. This podcast is produced by Grit and Gravel, your partners in marketing strategy and success.